I'm Ryan Miller,
I'm Molly McIntyre.
I'm Bray Kelly.
and this is the elbow evaluation for AIM 2.
We would be doing this bilaterally, but for the sake of time, we'll be doing it unilaterally.
For the duration of this video, they have permission to touch me.
They have permission to touch me for this video as well.
They both have permission to do elbow evaluations on me.
We're going to be starting with the special test. First is the Tinel sign. So I'm going to have the patient raise their arm up at 90 degrees. This is testing for cubital tunnel syndrome. And then we're going to be tapping right in the trochlear groove right here. And that's tapping on the ulnar nerve. A positive would be numbness or tingling in the fourth and fifth finger. Next special test is going to be measuring the carrying angle. So you're going to have your patient just have their arm down at their side like this. We're going to align the stable lever arm with the humerus. We're going to align the radius with the cubital fossa. And then the movable lever arm will be lined up with the palmaris longus. So we can see this angle right here is about 4 degrees of valgus stress. So for females, normal is between 10 and 15 degrees, and for males is about 5. So she's a little bit below average for females. So the next step is the gunstock deformity. So gunstock deformity is when you have a low or decreased carrying angle, sometimes going inward or in a varus angle toward your body or toward the midline. This is usually only because of a humerus fracture when you were younger. So Bray, have you ever fractured your humerus or have you had any problems with it?
No.
So for Bray, even though she was a decreased carrying angle, this probably would not be a gunstock deformity.
The next up is cubital recurvatum. This is a hyperextension of the elbow. It is caused by genetics. There's no pathology for it, and Molly does not have cubital recurvatum. Next up, we'll be doing the lateral epicondylitis test. For this, I'm going to Molly put her hand out. I'm going to put my hands on the lateral epicondyle, and then I'm going to have her flex down, and then I want you to put your fingers to the sky. I'm going to resist this motion. If she experiences any kind of pain or discomfort, that would be a positive sign, and a positive sign could be tennis elbow or lateral epicondylitis. Next up, we'll be doing the medial epicondylitis test. And so for this, I'm going to take my hand and put it on her medial epicondyle. My fingers are there. And then I'll be holding her hand, and I'm going to put her in pronation, and then she's going to come up into supination. So we're going to do it again. I'm going to stretch out her wrist flexors. And any pain on her medial epicondylitis could be a positive for a medial epicondylitis or a pitcher's elbow.
So now we'll be doing the pronator teres test. So what I'll have him do is he's going to resist pronation. Okay. And this test for median nerve entrapment as well as pitcher's elbow. So a positive for this test would be pain elicited during resisting pronation in the pronator teres and median part. So now we'll be doing the pinch grip test, which tests for median nerve entrapment, which could be due to cervical neck injury, carpal tunnel, as well as pronator teres syndrome. So first we'll do a negative test. So this is going to be tip to tip. So I'm going to pull away. Perfect, you see tip to tip. And then a negative pinch grip is pulp to pulp.
Next, we'll be muscle testing the tricep. The tricep origin, the long head goes to the infraglenoid tubercle of the scapula. And the lateral head starts at the posterior surface of the humerus. And then the medial head, also the origin is the posterior surface of the humerus. Then it inserts on the olecranon process. So now we're gonna palpate that. Its action is to extend the forearm, and the radial nerve is what innervates it. So now, Molly, do you have any shoulder impingement issues?
No.
Then can you please put your arm above your head? Beautiful, thank you. I'm gonna put it in a stretch position, and now I want you by yourself just to put your wrist into the air. Beautiful, thank you. Now I'm gonna add resistance. Ready, go. Beautiful, thank you. And then midpoint. And then I want you to push against my hand as hard as you can. Ready, go. 1, 2, 3, 4, 5. Thank you. On the Universal Muscle Testing Scale, Molly would be a 5 because she can complete the whole range of motion against gravity and with full resistance.
Next, we are going to be ligamentous testing the MCL. So I'm going to have Bray raise her arm up. We want to have a slight flex between like 5 and 20 degrees. I'm going to put my hand right here, right below the cubital fossa, and the other hand at the wrist. And then I'm just putting valgus stress on the MCL. And then we're feeling for an endpoint, and obviously we're looking for pain. So Bray didn't have any pain, and I could feel an endpoint, so there would be no ligamentous injury.
So now we'll be measuring elbow flexion with the goniometer. So the stable arm is going to be on the humerus. The center of the goniometer is going to be on the lateral epicondyle. And then the movable lever arm is going to be with the radius. So I'm going to have Ryan flex his elbow. Okay. And then I'm going to more. So that is at 129 degrees. And typically you'd want it between 145 degrees and 155 degrees.
I'm a 20-year-old football player, and I decided to go ice skating this weekend, and I have some elbow pain.
What happened?
So I was ice skating, and I fell down really hard and smacked my elbow on the ice.
Oh man, I'm really sorry to hear that. May I ask, where does it hurt?
Kind of like right down in here.
So in this area?
Yeah.
Awesome. Did you hear any noises when you fell?
Yeah, I heard a crack when I fell.
Crack.
Yeah.
Okay. Do you have a previous history of injury on this elbow?
I fractured this elbow, I think 3 years ago. Yeah.
Okay. And then, do you have any medical problems?
I'm allergic to bee stings.
Allergic to bee stings. Okay,
Yeah.
awesome. All right, I'm just gonna start by feel it. Does this hurt?
Oh yeah.
That's okay. I'm gonna percuss the bones around it. Let me know if you feel any pain.
Oh yeah.
Yeah?
Yeah. Yeah.
Yeah.
A little pain right there. Yeah.
Can I see your elbow, please?
Yeah. It's okay.
That's good right there.
Yeah, that feels alright.
All right. You gonna set it down? Beautiful. I'm gonna use a tuning fork. You might feel a little sting or pain. Will you please let me know?
Okay. Ow, ow. Yeah, pain right there.
All right. So I think this patient has a fractured elbow. I'm gonna recommend him to go get an X-ray, and I won't be doing any muscle testing because I do not want. I want to get an X-ray before I mess with anything else. I will put him in a sling and then send him off to get an X-ray.